Well, we know how many people have tested positive for COVID-19, but we really don't know how many people in our community are actually or have actually been infected with coronavirus.
And Heather, that all could change very soon. Our chief investigative reporter Morgan Lowe is live for us tonight with more on a plan here to count people who have antibodies to this virus. Morgan joining us live. And Morgan, hopefully you can answer this question. How on earth are they going to be able to make something like this even happen?
Yeah, Brandon, we had heard that this was in the works, but we didn't have any details until today. But now the Maricopa County Department of Health has announced they're going to be surveying more than 24 neighborhoods, talking to people and taking blood samples, and that will hopefully answer some really important questions. The COVID testing sites that have popped up across the valley have been an important tool in identifying people who are infected at the time of the test. But this is just part of the story. Today, county officials announced they're looking for the rest of the story.
We will be going door to door in 29 selected neighborhoods across Maricopa County.
Marcy Flanagan is the executive director of the county's Department of Public Health. She says a small army of county workers and volunteers from ASU will ask questions and take blood samples. The Mayo Clinic will run serology tests on those samples.
The information we get from the sero survey will give us an idea of how many people at this point in time have antibodies to COVID-19 from being naturally infected and likely immune to getting it again.
Flanagan says the result will be a better understanding of what percentage of the community has been infected, how close we are to herd immunity, and how or when public health officials can start relaxing some of the social distancing and mask requirements. Those health department teams will start leaving notices on front doors in those 29 neighborhoods next week. If you get a notice on your door, you can expect later a knock on your door. Now, this testing is totally voluntary. The people who will be knocking on your doors will have badges and identification that identify them as members of these teams. They will not enter your home. They can set up a testing tent in your front yard, or you can go to a mobile lab for testing. Again, it's voluntary, and all of this will be confidential, they say. Back to you guys.